Hi, I'm Pete Kudenchek, a lead investigator for the ALPS study, and I'm here today to talk to you a little bit about the mandatory use of the adapters for the ALPS syringes and why that's so important. As many of you know, in some of the training for ALPS, some syringes were found to not be functioning, that they appeared to be clogged. And I want to indicate to you what we found is the cause of that and why the use of the adapters is so essential to prevent that from happening. As you know, the study kits are each packaged with 3 adapters. And these adapters are essential for use with each ALPS syringe. And I want to explain to you why and then how we would suggest potentially enforcing your using these adapters. Imagine this IV set being connected to the patient on this side, and this is the portal through which you'd be administering drugs. What you don't see behind the plastic of this portal is, in some IV sets, a pin that sits inside the plastic. That pin inserts in the nipple of the syringe. And the problem is that in some IV sets with that portal, the pin is too big for the nipple of the syringe, and as a result, were you to connect the syringe directly to this IV portal, you could potentially plug the syringe, break off that plastic pin, and now you have a syringe that doesn't work anymore. This is a recognized problem. The FDA recognized it, and as a result allowed ALPS to proceed with the use of adapters that are packaged in each set that are designed to not have a pin inside of them. So behind the plastic of this adapter, there is no pin. There is only plastic. Any other adapter, you have no idea if a pin is present or not. Maybe, may not be. Assume it is, and always use the adapter when applying the ALPS syringe. Now, the way that we have trained locally to do this and what appears to work best, and again I'm going to illustrate this without using sterile technique, you apply sterile technique in your usual way, is when you open the ALPS kit, you first of all remove an adapter. There's a little plastic piece that's on the adapter that you would remove off, and apply the adapter first to the luer set of the syringe. Now there's a small amount of air in that adapter, but I think it's inconsequential. You would then take the ALPS syringe, you would burp what little air is in there, you would attach that syringe with 1/2 turn to the adapter. And the reason for just doing 1/2 turn is to prevent the syringe from popping off. You would clamp the IV as you would in a normal fashion to inject the drug. You would inject ALPS drug. You would remove the syringe, but keep the adapter in place. And you can keep that adapter in place, it will not back leak, for every subsequent use, not only of ALPS syringes, but every other drug that you administer. If that adapter, for whatever reason, gets contaminated or gets broken, good news. You've got 2 more to use if you need to, but you're not mandated to do that. Now, if for whatever reason, one of the study kit syringes becomes non-functional, either because you messed up and you didn't use the adapter, we hope that's not the reason, or it's broken, or for some other reason it's not used, here's the game plan. You close the study kit, and you proceed with standard therapy with your ordinary drugs. But bear in mind that if you've given any ALPS syringe, potentially you may have given antiarrhythmic drug. The big concern is if that drug happened to be lidocaine, because lidocaine has a dose limitation in the field, whereas amiodarone, typically the doses are going to be much higher, can be given much higher than lidocaine. So if you've given 1 or more syringes of study drug, assume you've given either 60 milligrams of lidocaine if it was 1 syringe, or 120 milligrams of lidocaine if it was 2 syringes, and limit your lidocaine doses accordingly. On the other hand, if your EMS system uses amiodarone, that's not a limitation because you can give up to 2 grams of amiodarone over 24 hours if you need to. Following this protocol, number 1, mandatory use of the adapters. And number 2, a bailout plan if anything goes wrong that a syringe is non-functional. I think will keep ALPS giving the drug safely and giving it effectively and hopefully saving lives as a result.